Washing hands. Hi, I'm Rose. I'm going to be your nurse today.
Hi, I'm Jill. Nice to meet you.
Nice to meet you. What brings you to the health office today?
Well, I've been feeling, I don't know if it's anxiety or if there's something wrong, but I feel like my heart has been like jumping out of my chest. It's not all the time, but it's more often in the past like few weeks. I'll feel it racing. I physically feel it, and I can feel it like thumping, 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 and then it stops. Um, So I don't know. I haven't had any more stress in my life lately. I'm not feeling nervous or anxious or about anything, but it's kind of freaking me out at this point.
Okay. So you've never had this before. This is really a new
Yeah.
symptom for you.
hmm
When you're having the palpitations, is there anything else going on? Like, are you short of breath? Do you feel dizzy?
A little bit. I get short of breath. If I'm walking, it happens. I kind of have to stop myself and like rest for a second. I mean, it's nothing like anyone around me would even notice, but like if I'm at work and I'm moving around, I just kind of stop and try and catch my breath while it's happening. I mean, the longest it's ever happened is maybe like 10 to 15 seconds, but it's definitely freaking me out.
Okay. Well, I'm glad you're here. And you made the appointment, so because obviously that can be concerning. Do you drink coffee at all, or any amounts like on a daily basis?
Um, I drink coffee maybe 5 days a week, like when I go to work, but it's a cup in the morning and I never really finish it.
And it's
So
caffeinated, not
yeah, yeah, I
decaffeinated.
think it's
Okay.
more just routine.
Okay, and tobacco, any
No, never
nicotine
smoked.
use or anything like that?
No.
I see your list of meds here, none of which would have a side effect of palpitations, so thank you for providing that. I do see that your vital signs, your blood pressure is a little elevated, your heart rate's a little bit elevated, your
Okay.
oxygen's good, so those are great. So I'm glad to hear about that. Do you any other symptoms, like any swelling anywhere, like in your body, or anything
My
else you've
my like feet
noticed?
and my ankles. The other day I kind of looked at them and thought they looked how they did when I was pregnant.
Okay.
Um, they almost, I don't know how to describe it, feel like heavier. And when I look at them, there's not a whole lot of like definition between my ankle and
Mm.
my foot anymore.
Like when you take your socks off, is there like an indentation
Yeah.
sometimes?
Oh, yeah.
Is it more at the
Yeah.
end of the day and you
It's
don't
more,
notice it in the morning?
I notice it a little bit in the morning, but the end of the day, yeah. Like when I get home, I have to put my feet up. When I
Okay.
do that, it kind of, the swelling goes down a little bit.
Okay, so those seem to be the most two kind of
hmm
concerning complaints for
hmm
today. Okay, all right. Well, I would like to at this point go ahead and just start to examine you.
Okay.
Okay, so hands are clean. We have masks on. Patient's in a gown. Just gonna kind of go from head to toe.
Okay.
Okay, I'll be using my hands, and I'll be also using my stethoscope. So I'm just gonna go ahead and inspect the chest wall, opening the gown, opening the back of the gown, watching you breathe. Okay, and then I'm going to be looking at your neck for any jugular vein distension, giving a good proper amount of time. Then I'm going to go ahead and just feel your temporal arteries. Give it a full minute, making sure that they're the same. No abnormalities there. Good. And if I may, I'm just going to kind of look at each one of your fingers, your fingers and thumb, and make sure I have a good cap refill, which is when I press and the color comes right back. Good. 1 to 2 seconds on all 10 of your digits. Perfect. Awesome. Would you mind if I checked right inside your groin? Your
No
pulse
problem.
is there. Okay, right and left. Normal. Behind your knee, which is called your popliteal. Okay, 1 minute. They both feel the same. I'm also going to do the same on the side here of your ankles. Okay, and then the top of your foot and the dorsalis pedis. They're good. Okay, great. All right, so you can sit up. Thank you so much. I appreciate that. So now I'm going to listen, kind of in the same kind of fashion. I'm just going to listen to each one of your temples here. We're using the bell and the diaphragm at certain times. Okay, no thrill. It seems normal. Good. Okay. Just do the same with your carotid arteries. No thrill. Excellent. Listening to your heart sounds in multiple places. Just breathe normal. Listening for 1 minute for every heart pound location. Okay, awesome. Just gonna do the same thing with the other arteries. Everything seems normal. Excellent. So I'm happy about that. I don't see anything glaring. I do hear that your heart's a little elevated. I don't hear anything that would make it seem irregular. So I am going to do a few things. I'd like to just kind of come up with a plan. So just gonna rewash my hands here after that exam. So given the fact that you're experiencing this and it's bothersome and you've made an appointment, I think we need to do a 12-lead EKG in the office here. I'll have the technician come in. I will look at it and read it and make sure everything that it looks normal, and we'll compare it to your last one. It looks like you haven't seen a cardiologist in the past. Okay. And you potentially were borderline hypertension, but never on medications.
Correct.
Okay, in the past. So getting an EKG is simple, and we'll get that done here in the office. If it does look abnormal, we have sometimes put people on what's called a Holter monitor. We can talk about that after we get some other things done. But I would like to go ahead and order some labs, just some routine things.
Is that like blood work?
Yeah, so I'm going to give you a slip, and it's going to be a prescription that you can call or do it online with LabCorp or Quest, depending on your insurance. And it's just routine stuff: electrolytes, blood counts, how well your blood is, coagulating or clotting, that type of stuff. So we're going to go ahead and get that done. Also a chest X-ray, just a one view, just to have that done. That's pretty simple. So that'll be radiology script. That'll be at a different place, at an imaging place. Some of the things I'd like to talk about though at home. I'd like to see if we could limit our salt intake. If we can do some journaling, if we could, meaning like, when you feel it, what time of day, what you had to eat or drink, maybe we can find some things that are causing it. Like you said, you did talk about anxiety, so I'm glad that you were able to express that you're not experiencing that, but maybe that could trigger it down the road. And then what I'd like to do is make an appointment for 4 weeks from now. But before that 4 weeks, I'll call you with the results of the chest X-ray and the labs. Do you have any questions for me at all? I mean, right now I don't have any additional medications to add to the list until I get those results back. But it could result in additional medication.
So should I stop with the coffee and maybe like not have salty food so much, kind of scale back on that in the meantime, or should I wait until I get my test results?
No, great question. I appreciate the clarification. Coffee is difficult to break. Sometimes I do tell my patients that you can start off with half decaf, half caffeine, and then wean off of the caffeine and do all decaf. It can be difficult. You can experience some headaches. That tends to work. But yes, no added salt is what we kind of call in the medical field, where you get foods that already have salt in them and then you put salt on them. So we don't want to add any additional salt. So yeah, so with your home cooking, going out to meals, just be cognizant of things that are salty, and let's avoid adding salt.
Okay.
Does that make sense? All right. So I'm appreciative that you came in, and we're going to get to the bottom of it. All right. Let me know if there's anything else I can do for you.
All right. Nice to meet you. Thanks so much.
All right. Take care.